Hi, welcome to Professional Certifications channel. Let's break down RHIA exam preparation, one topic a day for focused and effective learning. Today's topic is Patient-Centered Medical Home, PCMH, model in healthcare.
1. What is the Patient-Centered Medical Home, PCMH? So, what exactly is the Patient-Centered Medical Home, or PCMH? The PCMH is a model of care that emphasizes comprehensive, coordinated, and patient-centered care. It's designed to improve the quality of care by fostering strong relationships between patients and their primary care providers. The PCMH model encourages a team-based approach, where healthcare providers work collaboratively to manage all aspects of a patient's health, including prevention, chronic disease management, and overall well-being. The PCMH model is centered around 5 key principles: patient-centered care, comprehensive care, coordinated care, accessible services, and a commitment to quality and safety. These principles ensure that care is tailored to the needs of each patient, delivered in a coordinated manner, and focused on continuous improvement.
2. Key components of the PCMH model. The patient-centered medical home model is built on several key components that work together to create a more effective and patient-focused approach to primary care. Let's break down these components. 1. Patient-centered care. At the heart of the PCMH model is patient-centered care. This means that care is personalized and responsive to the needs, preferences, and values of the patient. The patient is considered a central partner in their healthcare, and their input is valued in the decision-making process. The goal is to empower patients to take an active role in managing their health. 2. Comprehensive care. The PCMH model aims to provide comprehensive care by addressing all of a patient's healthcare needs, from preventive services to chronic disease management to mental health support. A team of healthcare providers, including physicians, nurses, and specialists, work together to ensure that every aspect of the patient's health is covered. 3. Coordinated care. Coordination of care is a critical element of the PCMH model. This involves ensuring that care is seamless across different healthcare settings, such as primary care, specialty care, hospitals, and home health services. The primary care provider plays a central role in coordinating care, ensuring that all providers involved in the patient's care are working together, and that there is clear communication between them. 4. Accessible services. Accessibility is another key component of the PCMH model. This means making healthcare services available when patients need them, including offering extended hours, same-day appointments, and various modes of communication, such as telemedicine. The goal is to remove barriers to care and ensure that patients can access the services they need promptly. 5. Commitment to quality and safety. The PCMH model is committed to continuous quality improvement and patient safety. This involves regularly assessing and improving care processes, using evidence-based practices, and tracking patient outcomes. Healthcare providers in a PCMH are dedicated to delivering the highest standard of care and ensuring that patients receive safe and effective treatments.
3. Benefits of the PCMH model. The patient-centered medical home model offers numerous benefits for both patients and healthcare providers. Let's explore some of the key advantages of adopting the PCMH model. 1. Improved patient outcomes. By focusing on comprehensive, coordinated care, the PCMH model helps improve patient outcomes. Patients receive more personalized care, better management of chronic conditions, and timely preventive services, all of which contribute to better health outcomes and a higher quality of life. 2. Enhanced patient experience. The PCMH model emphasizes patient-centered care, which leads to a more positive patient experience. Patients feel more engaged in their care, experience better communication with their healthcare providers, and are more satisfied with the care they receive. This approach fosters trust and strengthens the patient-provider relationship. 3. Reduced healthcare costs. The PCMH model can help reduce healthcare costs by promoting preventive care, reducing hospital admissions, and minimizing the need for emergency services. By managing chronic conditions more effectively and preventing complications, the PCMH model can lower overall healthcare expenditures. 4. Better care coordination. With a focus on coordinated care, the PCMH model ensures that patients receive the right care at the right time, reducing the risk of medical errors and improving the continuity of care. This is particularly important for patients with complex healthcare needs who require services from multiple providers. 5. Increased provider satisfaction. Healthcare providers working within the PCMH model often report higher job satisfaction. The team-based approach fosters collaboration and support, reducing burnout and allowing providers to focus more on delivering high-quality care rather than managing administrative tasks.
4. Challenges and considerations with the PCMH model. While the patient-centered medical home model offers many benefits, it also presents certain challenges and considerations for healthcare organizations. Let's discuss some of the key challenges associated with implementing the PCMH model. 1. Implementation costs. Transitioning to a PCMH model requires significant investment in infrastructure, technology, and staff training. Healthcare organizations must be prepared to invest in electronic health records, EHRs, care coordination tools, and other resources necessary to support the PCMH model. While these investments can lead to long-term savings, the initial costs can be a barrier for some organizations. 2. Cultural change. Implementing the PCMH model often requires a cultural shift within the organization. Healthcare providers must embrace a team-based approach, where collaboration and communication are prioritized. This can be challenging in environments where providers are accustomed to working independently. Leadership must be committed to fostering a culture of teamwork and patient-centered care. 3. Complex care coordination. Coordinating care across multiple providers and settings can be complex, particularly for patients with chronic conditions or multiple comorbidities. Effective care coordination requires robust communication systems, clear protocols, and a dedicated care coordination team. Ensuring that all providers are on the same page and that care transitions are smooth can be challenging. 4. Reimbursement challenges. While the PCMH model can lead to cost savings, some healthcare organizations may face challenges with reimbursement. Not all payers recognize or reimburse for the additional services and coordination efforts that are central to the PCMH model. Organizations must navigate the complexities of payer contracts and advocate for payment models that support the PCMH approach. 5. Measuring and reporting quality. The PCMH model emphasizes continuous quality improvement, which requires organizations to measure and report on various quality metrics. Collecting and analyzing this data can be resource-intensive, and organizations must have the necessary tools and expertise to track outcomes effectively. Ensuring that quality improvement efforts are meaningful and lead to real improvements in patient care is essential.
5. Best practices for implementing the PCMH model. To successfully implement the patient-centered medical home model, healthcare organizations should follow best practices that promote patient-centered care, enhance coordination, and ensure sustainability. Let's explore some strategies for effectively implementing the PCMH model. 1. Engage leadership and staff. Strong leadership is essential for driving the cultural change needed to implement the PCMH model. Engage leaders and staff early in the process, and provide ongoing training and support to help them understand the principles of patient-centered care and the benefits of the PCMH model. Foster a culture of collaboration and teamwork across the organization. 2. Invest in technology. Leverage technology to support care coordination, communication, and data management. Implement electronic health records, EHRs, that are interoperable with other systems, allowing for seamless sharing of patient information. Use care coordination tools to track patient progress, manage care plans, and facilitate communication between providers. 3. Focus on patient engagement. Involve patients in their care by providing education, tools, and resources that empower them to take an active role in managing their health. Encourage shared decision-making, where patients and providers work together to develop care plans that reflect the patient's values and preferences. Make services accessible by offering extended hours, telemedicine, and other convenient options. 4. Establish a care coordination team. create a dedicated care coordination team that includes a mix of healthcare providers, such as primary care physicians, nurses, social workers, and care coordinators. This team should be responsible for coordinating care across all settings, managing care transitions, and ensuring that patients receive the services they need in a timely manner. 5. Monitor and improve quality. Continuously monitor quality metrics and patient outcomes to assess the effectiveness of the PCMH model. Use data to identify areas for improvement and implement evidence-based practices that enhance care delivery. Engage in regular quality improvement initiatives that involve staff at all levels and focus on achieving measurable results. 6. Collaborate with payers. Work closely with payers to develop reimbursement models that support the PCMH approach. Advocate for payment structures that recognize the value of care coordination, patient engagement, and quality improvement. Explore opportunities for value-based care contracts that align financial incentives with the goals of the PCMH model.
6. The future of the PCMH model in healthcare. As healthcare continues to evolve, the patient-centered medical home model is expected to play an increasingly important role in transforming primary care. Let's take a look at some trends that may shape the future of the PCMH model. 1. Integration with value-based care initiatives. The PCMH model aligns closely with value-based care initiatives, which focus on improving quality while controlling costs. As the healthcare system continues to shift toward value-based care, the principles of the PCMH model will become even more relevant. We can expect to see further integration of the PCMH model with other value-based care strategies, such as accountable care organizations, ACOs, and bundled payment models. 2. Expansion of telemedicine and digital health. The rise of telemedicine and digital health tools will enhance the accessibility and convenience of the PCMH model. Patients will have more options for accessing care remotely, while providers will have new tools for monitoring and managing patient health. The integration of these technologies into the PCMH model will help expand its reach and improve patient outcomes. 3. Focus on population health management. The PCMH model will continue to play a key role in population health management, particularly for managing chronic conditions and improving preventive care. By leveraging data and analytics, PCMHs will be able to identify high-risk patients, tailor interventions, and track outcomes more effectively. This population-based approach will help reduce healthcare disparities and improve the overall health of communities. 4. Increased collaboration across care settings. As healthcare becomes more integrated, the PCMH model will involve greater collaboration across different care settings, including specialty care, hospitals, and community services. This will require enhanced communication and data sharing capabilities, as well as stronger partnerships between providers. The goal will be to create a more seamless and coordinated care experience for patients. 5. Evolving reimbursement models. Reimbursement models will continue to evolve to support the PCMH approach. As more payers recognize the value of patient-centered care, we can expect to see increased adoption of payment structures that reward quality, efficiency, and care coordination. This will help ensure the sustainability of the PCMH model and encourage more healthcare organizations to adopt this approach.
Conclusion. In conclusion, the patient-centered medical home (PCMH) model is a transformative approach to primary care that prioritizes comprehensive, coordinated, and patient-centered care. By following best practices and staying informed about emerging trends, healthcare organizations can successfully implement the PCMH model and deliver high-quality care that meets the needs of their patients.